conversation. A big thank you to you for sharing those thoughts with us. But let's speak to the spokesperson for the Health Ministry, Tony GOODMAN, joins us on the line. Good morning to you.
Good morning, my brother.
I hope you're well.
And I'm blessed with you.
I am also well. First, let's start with why the minister has decided to do this unannounced visits.
Thank you, and good morning to our church listeners. No, it's important to do some of those things. You have come into a sector, you've been at the other side, you go to hospital, you see some of the things happening. You have come in, and then you are told that there is a process we go through in terms of monitoring and evaluation here and there. And you know that most of those things do not actually reflect what happens on the ground. You quickly would have to adopt a strategy that will make people sit up, that will make hospital managers sit up. So the minister has decided that he won't go through the normal process where you announce that I'm coming to a hospital, then people put things together, do painting, clean their compound here and there. The plan now is to visit them unannounced and see what patients go through. You and I go to hospital, there are things we go through, we complain, we do not have results. The minister wants to see it himself, and if possible, together with the hospital, deal with some of the problems we go through daily.
And so far, what is he finding?
You know, most of the places, as you may be aware, we are told that there are some equipment that have not been functioning for a number of years. We've also seen that patients go to hospital and they have to pay for washroom fees. We also have patients who go to hospital and will have to spend a lot of hours before they are taken care of. Some instances, patients will have to wait, and then the doctor who is supposed to take care of this patient is also attending to a different patient in a different facility. So all of these things are some of the things he has seen and has put in place measures to deal with it. One of the measures he has put in place is to make sure that the equipment government supplied to the hospitals will create a CAPEX account for some amount to be put in there. In case that equipment breaks down, we'll be able to repair it with the money we have kept. It shouldn't be business as usual where these equipment are donated or supplied to the facilities. We wait till they are obsolete or they collapse or beyond repair before we come back to government to say, government, we need equipment. There should be a clear regime managing this equipment. He's also put in place a measure, which is that you and I should not go to hospital and be paying for washroom fees here and there. All of those things are a thing of the past. Going forward is making sure that the basic things we need to see in a care facility that is actually provided. In Kolebu yesterday, the minister saw some things. You all know the famous surgery department or surgical department in Kolebu. He was actually critical in making sure that that building and the environment of the building is given some facelift. He spoke to the head of department there, and they have discussed a lot of plans. At the maternity ward, it's also discussed some plans going forward in making sure that this is what we have. This is the quality we have for now. We need to make sure that we put in place some measures in the interim to forestall the pressure that people go through anytime they go to hospital. So we believe that it's working. It is working. Where we find out that people just take up positions and are not actually performing their roles. If it's query, you have to query. You have to let people know that this is why you are here. You have to let people know that you are not there to waste time, but you are there to stop a regime and make sure that the resetting all of us as a Ghanaian have accepted would come to play in the scheme of things.
In fact, this morning, and before I come there, because this morning we had quite a few things, some of which you've addressed. This is Nicholas Laguda. Nicholas Laguda says, as a former staff of Kolebu Teaching Hospital, I know the radiology department was generating a lot of money, especially from CT scans alone. but not much was made available for the maintenance of the equipment and the department. I totally agree with Honorable Akandor'S proposal for such a fund to be set up, and if well managed, can help a lot to improve on the healthcare delivery. This proposal you are making, is it limited to Kolebu, or how will it operate?
Thank you very much. You remember that when the minister visited Tamale Teaching Hospital, it was one of the things he mentioned. When he went to Ridge Hospital and realized that X-ray machine has been there for a very long time and it's not functioning, CT scan has been lying dormant for a very long time, he mentioned that government should not be just pumping money into equipment without getting some a regime of maintaining those equipment. He mentioned the money spent on equipment replacement project by His Excellency John Mahama during his first term, about $260 million US. We bought equipment for all facilities, including some CHAC facilities across the country. And then you are told that these facilities are not working, these equipment are no more working. You ask yourself, so what is the return on the money you invested? If you've spent money, you expect that you get some profit, even though we are providing public service, some minimal profit that will service the equipment that was taking care of the people. The minister always put it that you need to take care of the bird that is laying the golden egg. So we believe that this is the only way we can help the sector, and we are going to continue to even a CHIPS compound, because we make some donation or supply to all these facilities, district hospitals, regional hospitals, CHIPS compound, health centers. You and I, we go to hospital and pay some amount of money to run these scans and then diagnostic services. What happens to these amounts? Is it spent on something else? We need to look at the whole regime and make sure that government does not only procure. Government should make sure that some of these procurements we make, we get the benefits from the procurement. It shouldn't be, I bring it to you, you spend it, when it's down, you call me again. I'm not sure we can go forward with this. It is one of the reasons why this Health World Assembly is looking at health financing. You cannot continue just investing without getting anything. You cannot just investing without making sure that some people are put in place to maintain what you are investing there. Well, health financing all over the world is now a topical issue, and that is why this year's Geneva is going to look at that.
How far will the health minister go with this? Because so far we've seen him at the big hospitals. But some of the things and we're just speaking to a few of our listeners this morning. One of them did not mention any of the big hospitals. He mentioned a hospital in Menchia. This is not a big hospital. Is he ready to go to all of these places? Or how far will he take this?
So yesterday we were actually going to a district hospital. But we had this big delegation coming to us, the CDC DG was also coming, and we have to lead him to the presidency and all that. So we had to go to Kolebu. Kolebu wasn't the plan. So wherever you are, just prepare. You may not know. The minister may come there tomorrow or tomorrow next. So it's not as though we are going to the bigger hospitals. But yesterday was because of proximity. That's why we went to Kolebu. The district hospital, CHIPS compound, and other health centers will also receive their fair share.
And usually these hospitals are managed by people sometimes put in place by the Health Ministry, Ghana Health Service, among others. The minister cannot be in all places at the same time.
Mm-hmm.
He can make policy proposals and even push for hospitals to do certain things. But whether or not they do it is another issue. How is the minister going to ensure that everything that he's putting forward, including the CAPEX for the management of the equipment that is purchased at high cost by the government, how is he going to make sure that all things are done, all these things are done?
Let's not also let the whole thing look as if there are no people managing the facility. We don't have people who go around to make sure that such facilities have the best environment for our patients. We have the system is actually running. What he is doing will not take away from the peer reviews the ministry, the hospitals do go through. This will not take away the monitoring and evaluation, the various monitoring and evaluation units who do. This is the minister's style to put everybody on his toe. This is the minister's style to make sure that if you are even assigned to monitor an institution, there is the watchman's watchman who would also go around. So everybody will be careful. You know, he's just not ready to practice any armchair ministerial thing. He wants to go down there. He wants to be part of the system. When the system is fair, then you can sit down and know that, okay, if I'm sending these resources to this environment or this hospital, it will be taken care of. And this is what we have all agreed on. He is just carrying the people along in the health sector. Now, this is my policies. This is what I want to do. Agree with me. Let's implement this together. So that is what is happening, carrying everybody along.
And because I want to conclude by reading this comment to you, and this is coming from Dr. Amenshia, who says, "Good morning. I requested a medical report from CAT. They asked me for 2,000 Ghana cedis. I paid, and later the receipt attached to the report was 150 Ghana cedis. I wanted to report it, but upon considering the potential consequences, I dropped it." He says they have all the soft copies of this and even the call and the conversations they had over this matter. For many people, and if you listen to some of the calls we had, it is these payments that are made and sometimes having to pay nurses to even do their basic jobs. That if you don't tip them, they act like as if you don't even exist. This matter, I'm sure it's also come to your attention. How do you intend to deal with it?
You see, these reports are generated by specialized photocopy. It's called, it has a name. It's a photocopy, but it's a medical one. Most hospitals do not have it. They have to go to other facilities to generate some these reports. Kolibu, when we donated the equipment to Tamale Teaching Hospital, we added some of these photocopies. Going forward, we have to make sure that all the facilities where we have this, even if they are generating that money, they are going to collect from the man. I'm sure if it was their own photocopier, they won't collect that amount. The amount will be minimal. At least some portion will be kept. So that when we are buying, we'll buy enough. And then whatever amount he paid that day will be reduced further. It is because we don't have it in the system. So the monopoly kind of thing, somebody has it in his facility, so he's collecting a huge amount. Or a department in CAT or Confanochi has it, and it's being run by a private person, so they have their own amount. We have to make sure that whatever equipment we donate to the hospital or supply to the hospital should be kept well. Whatever we generate should go back to service the equipment. If all of these things are taken care of, I'm sure you will apply for some of those medical reports, and it may take just 50 Ghana or 100 Ghana for you to get. But the monopoly in the sector, because we will break one down and make sure that the other one is running, and then that will become the biggest thing around that community. So everybody will go, and the man will just increase the amount of money. It's happening here and there. It's happening around most of our facilities in the country. The one in the main facility is down. The one out, the private one, is functioning. So if a hospital in that facility is going to the private man, he has his own cost to charge. So it is a holistic thing we just have to look at. I remember when His Excellency George Dramani Mahama commissioned the holistic assessment in the health sector during his first term. All of those things were reviewed. But I'm sure we've gone to sleep a bit. So we have come back and we are seeing all of those things. That is why you have Agenda 111, which is also lying there. We don't know how to go around this particular. But the health sector, the kind of debt that it is being seen here, it's a joke. That is why you have nurses, what do you call, rotational nurses threatening that will go on strike. There are other nurses who are also home who need to be recruited for how many years now? A lot of debt. And equipment are broken down in the hospitals. So we have a lot of debt we need to actually take care of. But I can tell you for sure that we are ready for the tax. The minister is ready to make sure that some of those things are addressed and that we get the benefits. And the Ghanaians will derive the best care they want in any of the hospitals they visit.
Mm. Well, thank you very much for speaking to us. I understand you'll be on Pampaso today.
Yes, I'll be around today.
Okay. So do join him later on Pampaso as they discuss these issues and many other issues in the health sector. But thank you for speaking to us.
Thank you very much.
Tony GOODMAN, spokesperson, Ministry of Health, joining us on the line. This is Mohammed Musa. Hello, sir. My brother was involved in a motorcycle accident and was set to Cath. He was operated on and later realized that the amount they were charging was going to someone's bank account. I have every invoice and the pay slips. I want to report this. Okay. We'll find out who you can report to when you discover these things. But are you looking for authentic, durable, and long-lasting UPVC and HDPE pipes for all your plumbing and construction needs? Then look no further. Did you know for over 50 years, Duraplast Limited has been the only name behind quality and durable pipes in Ghana and other West African countries? Duraplast Limited precision is a virtue we trust most. Hence our consistency in providing you with ISO certified quality UPVC and HDPE pipes for accurate and excellent plumbing or electrical works, including drainage pipes for free flow of water without implosive blockages. For your water storage, Duraplast gives you the ultimate in water storage tank, water tank. It's the only water storage tank with a level indicator to help you know the accurate water you have at home and of course your offices. Call Duraplast Limited today on 0242 818 874 for your water tank and other plastic pipe products. Locate us at plot number 10, 11 and 12 Daddy Ban Road, North Industrial Area, Accra North, or locate a distributor close to you for authentic Duraplast products. Water tank. Remember where Duraplast goes, water flows. And of course, Duraplast says I should share with you today that regular maintenance is important. So regularly inspect and maintain plumbing fixtures to prevent leaks, clogs, and other issues. Regularly inspect and maintain plumbing fixtures to prevent leaks, clogs, and other issues. That's the tip from Duraplast. Before we make way for Chami Bajimba, don't forget, Furniture City's 20% discount, 20% discount to you on all furniture items. Whatever type of furniture you're looking for, go to Furniture City. You can find them off the main Spinters Road. They also have an outlet in Tema and also in Kumasi. I mean everything you need when it comes to furniture for whatever type. Bedroom, for your office, for kitchen, for your garden, for even event furniture, for your church, for your hospital. They have all types of furniture. It's 20% off. Call them on this number 0241 213333 and also 0540 314948. Ghana Van Dam has been sending me this message consistently. He says, the capital needs more hospitals. This will take the pressure of the existing ones. The population is growing fast. JM should turn the National Cathedral grounds into a world-class hospital. A trauma and accident hospital will be ideal because of the location. There are those who are even proposing the children's hospital and a productive what do you call it? Fertility clinic. That they should cite it there. Thomas Dochisi, MP. Okay, thank you very much, and good morning to Bernard Ivo. We are back tomorrow with another edition, Friday edition of the Gold Morning Conversation. Do make a date with us. Coming up next is the King of Mid-Morning, Ochiami Bajumba, with a mid-morning show. It will be followed by Gold Talk Sport with Muftar Adamu and SM and Sandra. And that will be followed by Pampaso with Ranso Kwesi Boachi, produced by Elvis Sebiga.
One station.
Accra 2022, 23, 24 and more. We don't chat, back live.
Commercial free.
That's us mid-morning show.
Oh, we love what you have in Bad Drama. Mid-morning show.
The mid-morning show.
Yes.
90.5.
Good morning, my neighbors. On Chama, my drama.
Experience quality
Radio station.
Put your hands up.
Rave.
Yes.
powerful.
Morning vibes and more. Accra 90.5. We don't jam here by Drama.
Whoa, we love you.
Your mid-morning show on Radio Go.
We are back like 100 times. 2 times bigger. 90.5.
All the things I know that you deserve.
Mid-morning show. Wait, don't tell me by Drama.
For years, the Ghanaian passport has been more than a document. It has been a gateway to dreams, ambition, and belonging. Today, we move forward, introducing Ghana's new chip-embedded passport, safer, smarter, and globally recognized. Now, enjoy 24-hour passport services, real-time e-tracking, doorstep delivery, a 30% reduction in fees, and you get your new chip-embedded passport in under 15 days or in just 5 days with expedited service. The Mahama administration